Patients report efficacy and improvement. We're big believers in getting people on the right treatment. I feel like it's my ethical responsibility to reduce stigma. And I think hopefully that's the legacy of my career. We offer primarily a med management service. We've been coming out with new service lines as well. We've found that access to care in our community has been very, very difficult, especially for treatment-resistant patients. So we have what we call a treatment-resistant program, where we offer different techniques other than medications. So there are lots of patients that we call treatment resistant, meaning they've been on multiple medications without efficacy or just partial efficacy that affects their overall daily function. So we have TMS, we have Spravato, and we're coming with new treatments in the coming year as well to add adjunctive therapy services. So we're very, very excited about our treatment-resistant program. In the past, when we referred patients, we would have to wait for weeks or months for them to get services, and now we're getting them within a matter of a week or two, and that's made a huge difference. We're very selective. We allow the patients to meet with a provider and decide which is going to be the best option. Spravato particularly is helpful. It's a new age antidepressant is what we're calling it. It works very, very differently. It's not the conventional SSRI, SNRI. And I think the drawback with the conventional treatment is we have patients that are acutely ill, and we don't have methods and treatments that work very quickly. Now we have Spravato treatment that will work almost immediately within the first treatment session. Patients report efficacy and improvement. And that's cutting edge for psychiatry. We've never had any such treatments in our past. And the mechanism of action is also very different. It comes from the family of anesthetics. Again, work very, very, very quickly, and it antagonizes what we call the NMDA receptors. TMS is transcranial magnetic stimulation. No, it's not ECT, it's not electric shock treatments like people often think. It's stimulation of the cranium, and it's superficial. No anesthetic needed, no sedation needed. You can drive to your appointments. It's very convenient. It's also indicated for treatment-resistant depression. One of the things that's also lacking in our community is various clinics, we do not provide long-acting injectables. The data is very clear on this. For compliance, for efficacy, they are more effective, and we're big believers in getting people on the right treatment, and maintaining treatment is huge for our population. Not just for compliance issues, but for just how these medications work. When you give someone a pill, even if they're compliant, they take the pill, you have the half-life, which is how much is left over of the pill, and then you have peaks and troughs and waves. With the injectable, we have a sustainability, and people just do better on them in general for maintenance. And so we really advocate for those when we have the opportunity. Again, we have a young population, college age, they're busy, they don't want to take their medicines, they forget doses, and this offers a solution. That's why MedPsych exists. I'm an internist as well, and it's not the same in our culture. We don't treat medical patients the same way we treat psychiatric patients. And I wanted to change that. I feel like it's my ethical responsibility to reduce stigma as much as I can as a provider. And I think hopefully that's the legacy of my career, is that every patient who walks in this office feels like they're the only person in the room at the time. Stigma is huge in our culture, and we're a developed nation. Imagine other parts of the country where mental health is not mainstream. In this country, it's still not mainstream. And I think there's a lot of work that still needs to be done on awareness and reducing stigma. I find it in my colleagues, my medical colleagues. They still have misnomers about mental health, and if doctors are still not educated, what more our society? So I think there's just a lot of work that needs to be done still. And here at MedPsych, we're trying to break it down one patient at a time.